Hello to everybody and you're very welcome to the launch of Inclusion Ireland's 2021 pre-budget submission. I have with me here today Robert Murtagh, who is the Policy and Advocacy Coordinator with Inclusion Ireland. We're also joined by Sarah Jane Lavin, who is a Director of the Board of Directors of Inclusion Ireland. Rob and Sarah Jane and myself are going to give you a presentation on our pre-budget submission 2021. I think from the onset, it would be fair to say that this year we're really looking for the membership of the organisation, the supporter of the organisation, to get involved and to get involved locally and to lobby your local TD and to ensure that the issues that are important to yourselves are on the national agenda of this government for this year's pre-budget submission, and to ensure that those issues are taken seriously when the budget 2021 is being formed. We have divided up key priorities of the organisation. To get these priorities of the organisation, we consulted with our membership right throughout our regional offices. Unfortunately, this year, due to COVID, we were restricted in the number of meetings we could have, and as a result of that, all the meetings took place via Zoom rather than face to face. We did publish a survey, and 164 people fed back your views in relation to that. We have created 4 main teams which have come back from the consultation with yourselves, and those 4 teams are invest in inclusive education, promote the rights-based services, support community inclusion, and the final one to enable equality and participation. And within each one of those, we have a number of asks. So, for example, in investing in inclusive education, we're talking about reducing class sizes. We're talking about the EPSIN Act, for example. In terms of promoting rights-based services, we're looking for additional therapists. We want to ensure that 15% of the disability budget goes for community-based services. In terms of supporting community inclusion, we talk about housing, we talk about employment and poverty, we talk about transport. And in relation to enabling equality and participation, we're looking for full investment in the decision and support services. And these are all issues from yourselves. These are all the key priorities that our supporters have, that our members have, and we have put these together into our pre-budget submission for 2021. At this point, I'll hand to take you through this slides.
Thanks, Enda. So, one of the main things that regularly comes up for us each budget year is the issues around education. And I think, as you can see on the screen there, reducing class sizes so that no child is in a class of 30 plus has been a common ask that's come through to us. So, you know, large class sizes are one of the biggest barriers facing teachers in supporting children in schools. And they're a key barrier to delivering inclusive education. Over the 2016-2017 average class size in Ireland was 24.6 compared to the OECD average of 21. So it's quite significantly higher compared to other countries. And in primary schools, almost 1 in 5 of all primary school children attend a supersized class of 30 pupils or more. So, you know, large class sizes, they don't leave much, you know, they leave little space for the kind of differentiated learning that is needed for a lot of children with disabilities, and for, you know, diversity of learning needs. And they often lead teachers to be stressed as well in those environments. So it's a key issue and has been one that's repeatedly come up. Related to that, of course, is the legislative end of things, which is the EPSIN Act and the Education Admissions Act. And we've put in that one of our priorities is to commence that act fully. It's something, again, that we've raised year on year. In 2004, the EPSIN Act was to represent kind of a fundamental shift in how special education needs will be met. But still now, what I suppose nearly 16 years later, it hasn't been fully commenced. It was supposed to lead to independent appeals and educational assessments for children. That still has not been implemented as part of the Act. And that's despite it being, a pillar of the National Disability Inclusion Strategy as well. Similarly, the Education and Admissions to School Act allows for the HSC, for the NCSE or TUSA to place a child into a school where they can't find, when they can't find a local school to attend. That's still not been fully commenced. So it's that act is needed to address, I suppose, the unwillingness of some schools to enroll children with disabilities. So that's another very, very it's a big priority ask for us. And I suppose, like a lot of our, as Enda mentioned earlier on, we've had a lot of input from people around the countries in our survey and consultations. And what's come back from people, I'm going to read out a couple of quotes from people in relation to education. One person has said, everyone should be able to learn together and go to school together. When I was younger, I had to go to a special school and none of my friends were there. Another person has said, invest in teachers, make special education training mandatory for teachers. And someone else has just said, quite simply, but I think this kind of sums it up, we should get the same education that our family and friends got. It needs to be made more equal. So that's kind of the education end of things. Moving on to rights-based services. So again, a key feature of our budget submissions over the years has been around therapist posts. Therapy services are a key support to both children and adults with disabilities, and research indicates the importance of early intervention when it comes to the provision of therapy services. So the HSE National Service Plan outlined a number of priorities to improve the provision of the assessment of need. I think a lot of people are well aware of the delays in relation to assessment of needs. If you're a child living in the Dublin area, you've virtually no chance of getting your assessment needs done within the legal 6-month time frame set out in the Disability Act. And that's just that one example. There's a similar kind of trend that can be seen throughout the country in that respect. So we've put in as a priority ask for 100 new additional therapist posts for each of the next 3 years to be brought in to help address this. Our second ask, as you'll see there, is to ring fence 15% of the disability budget for community-based services. So what this means is that, as well as ensuring that all new monies allocated to disability services are spent, must be spent on community-based services. I think COVID-19, as we've seen, has kind of highlighted some of the issues with the traditional provision of disability service provision in Ireland. We've seen that people congregating in settings, in homes or in large buildings for day services sometimes isn't the most safe, or well, in COVID terms, it's certainly not safe in relation to how the virus spreads. But also, I think it highlights the fundamental problems with that kind of provision of services. It's something that Inclusion Ireland and many others in the disability community have raised repeatedly, that there's much better outcomes for people with disabilities, much better quality of life if they have services in their community that are not based in a congregated setting in many cases, but sees people actively involved in meeting people, in being part of their community. So we would say that there should be the disability budget should ring fence money for community-based services to address this. And again, the quotes that came through in our submission would highlight this. One person said, I've never got speech and language therapy even though I could do it. I'm on a list, but I've heard nothing for 2 years. That again highlights the issues in relation to the therapist posts. Other people have said waiting lists for appointments are too long. Again, we're talking a little bit about the community inclusion aspect of things. Someone else said it would be a good idea if hospitals had training for their nurses and doctors on helping people with a disability. It would make people less worried and stressed about going to the doctor. So they're just some of the voices of people that are coming through in relation to these issues. And I think, and Sarah Jane, I was going to bring yourself in here in relation to personal budgets as well, because I know one of the things that would be part of when we say ring fence 15% of the disability budget for community-based services, part of that would be looking at the personal budgets end of things. What would you what would your opinion on personal budgets be? And,
Well, I think more people should be allowed to apply for it, because for me, the services are not run very well anyway before. They're certainly not being run very well now. I have no contact at all with my service. I get the odd phone call for about 20 minutes, maybe every 2 months.
Yeah.
And most of the time, then I don't want to talk to them anyway because they're talking rubbish. That type of way.
Yeah, yeah. And what would a personal budget do for you if you were to get one of them, Sarah Jane?
Yeah.
What would that do for you, Sarah Jane?
No, that would make my life so much better. At least I'd be able to have control over my support and that. Because at the moment I don't choose. I'm told this is what you have, and
yeah.
do as you're told, and that's it. But at least if I had the support, I could say to them, this is what I need help with.
Yeah.
You know what I mean? At least I would be able to tell them what I want done. And
no,
at the moment there's no one like.
Yeah, it would give you more control. And I know there's a personalized budgets pilots currently underway.
Yeah.
And
I'm due to be interviewed for that shortly, they said.
Yeah, well, hopefully you might be involved, but it's something that needs to be rolled out nationally, in the next couple of years once the pilots are finished.
Exactly.
I think one of the issues with the personal budget has been that it's been kind of limited to just people who are already interacting or involved with a disability service. So people that don't have access to a service are kind of precluded from applying for that budget pilot. So that's something that needs to be addressed.
For anybody with a disability that wants it, because some people would probably turn their families who or the person himself would say, "Nah, I don't want that." But a lot of them could turn around, because the minute I heard about it, I said, "Yes, this is for me."
Yeah, I think a lot of people with disabilities would say the same thing. So moving on then to supporting community inclusion. So this is another team we have. So under this section, we've housing. So housing, again, has been a huge issue. We got a lot of responses in relation to housing in our consultations and our survey. And as many people be familiar with, deinstitutionalization again came up. We've put in and asked to increase the funding for deinstitutionalization and complete the full transition to community living within 5 years. So, anyone that's familiar with this issue will know that there's still thousands of people living in congregated settings. This is despite the Time to Move On strategy that was originally supposed to finish in 2018, missing year-on-year targets. There was new targets set up post 2018, but still, I think it's a real concern, the pace of which people are moving out. It's certainly not quick enough, and I think we would have looked for more from the government in relation to their program for government, where they didn't necessarily commit to any time frame for moving people out of those settings. That's all we've put in within the next 5 years, but of course we want this to be as immediate as possible, and it needs to be addressed. I know recently we've seen a report just as recent as last week from HICRA that highlighted the poor quality of life that people with disabilities experience in these settings. And wouldn't be the first one of those reports. They seem to come out every few months or every year, and they say the same thing, but we're still dealing with this issue. And HICWA again, I think about a year ago had a report that said that there was 2,900 people living in these settings. So almost 3,000 people are still in these settings. So it's something that needs to be addressed immediately. And then the second main ask in housing we have, again, is around the issue of support services. So we're asking for funding to be ring-fenced for support services for people with disabilities to live in homes in the community. So
in their own home even. Yeah,
in their own home. So what we mean by that is that we've from talking to people, they've told us that one of the biggest issues they come across is the difficulty they have in accessing supports in order to live in a home. So often what people find is they may be on the social housing waiting list, they may even be prioritized because they have a disability, but they find that they can't actually live in the home without support services. And to get those support services, they have to, make contact with HSE and try and get those support services set up. And this tends to be a virtually impossible task for a lot of people, and it just doesn't, there's no real clear pathway for people to get that. and it's a real barrier that people come up against. So we've asked for there to be more communication and coordination between the HSE and the Department of Housing, but importantly to ring fence funding so that support services can be made available for people to live in their homes. And again, the quotes coming through from people kind of highlight this. Someone said there should be more social housing so that people like us stand a chance at getting an affordable house. Someone else said all houses should be accessible so that anyone else can live in it. And then a final one said, the government needs to address the issue for housing for persons with a disability. The long-term housing need of each individual requires careful assessment and should be provided close to town centres and all services. So that kind of chimes with what we've put in there. So still under community inclusion, we have other aspects as well on employment and poverty. So people may be aware of the ability program that's been run. By all accounts, there's been a lot of positive work done in relation to that. It's something that we would like to see rolled out nationally, and that there will be job coaches provided in all in-show offices. And Sarah Jane, what would you say in relation to the housing aspect, or sorry, the employment aspect of things? Like, how do you feel? What's the importance of job coaches? Would you think?
Well, they are supposed to get jobs and help people in their jobs, but we need more of them because, as far as I can see, there isn't enough.
Yeah.
You know,
it can be very difficult to get the support in employment without a job coach, and to work with employers as well. And we also have under this section as well to introduce a cost of disability payment.
But I think we should all be given a living wage, because I myself asked, could I live on my pension and my units if I had to later on?
Yeah,
that's what I ask. It's at the moment all right. Mum's there that kind of do that, but if I'm on my own, could I do it?
Yeah. It all kind of ties together, doesn't it? Because even the next section, transport as well. We talk about cost of disability, but a lot of people with disabilities spend a load of money on transport, whether it's taxis, because of the lack of accessibility. What would you say in relation to transport as well, Sarah Jane?
Well, I think that, first of all, I haven't been on a bus for over 6 months, so I don't know what they're like now. But before, I think they need to put on more buses, because it's bad enough before. Whereas now I've seen, as far as I can see, they only use half the seats because with all the social distancing.
Sure, yeah.
But not only that, they need to make room for more than one wheelchair. Because I took a picture of the new buses out where I am, the go-ahead buses. I actually took a picture because they'd room for one wheelchair. And the bin was in the wheelchair section. They had a bag for rubbish.
Yeah.
No,
there's some real issues. There was already a lot of issues in relation to accessibility of transport, and I think COVID has kind of just even highlighed that again.
Exactly.
There's less spaces on buses
because
now.
As I say, now I'm saying to myself, even when I get on the buses, am I going to be safe? Like, am I going to? I'll probably be wiping everything down before I sit down. The same on airplanes.
Yeah.
Even if they're cleaned already.
Yeah. So,
but as I say, I haven't been on one in over 6 months. So basically, for the last 6 months, all I've done is gone around Klein if I need to go to the shop to buy something, and that's it.
Yeah. And I think, like, looking at our responses on the survey and consultations, we've seen this is what people were saying about cost of disability. I have to pay for taxis all the time because I find it hard to stand and wait for the bus.
Taxis, definitely, they should be allowed to use. I think they need to roll out the travel pass.
Yeah.
It's like, in Dublin Airport now, I heard yesterday, they're going to put up a toll outside Terminal 1 and 2. So now if you're going to the airport from now on, you will have to pay. If you're dropping people off, you won't be able to. And what people are saying now is the locals, that people are now going to be dropping them off at the side of the road. They won't go into the airport. They'll drop them outside on the road.
Yeah, there's lots of barriers. And then just going back even again to cost of disability, like for children with disability. So one person said as well, for a child with a disability, there are hidden costs for families, particularly in terms of social outlets, diet requirements, premiums attached to group activities. So transport as public transport might not work. So there's a lot of different issues coming through for people in relation to that.
You know, even school buses, because some people can't go to their service because there's no transport to the service.
Yeah.
Then naturally they can't go.
So we've asked in relation to transport as well to have full accessibility across all transport services, and to extend the passenger assistance scheme nationwide, because in particular that's needed in rural areas. Moving on then to, I think this is our final main ask. So this one is in relation to assisted decision making and the decision support services. So for anyone that's aware, the Assisted Decision Making Capacity Act, and we're still kind of waiting for that to be fully commenced. And one of the key parts to fully commencing that act is for the decision support service to be fully funded and fully established. So for the last couple of years, the service itself has asked for funding in the region of €9 million each year. It hasn't received that full funding, as far as I'm aware, especially in particular, I think in 2018. We believe the same for last year, but there's definitely a need for this service to be fully established. And I know the mental health commission themselves have stated the need for this to happen, as has the decision support services. So, you know, this act, this Assisted Decision Making Act, it's going to be it's a really important piece of legislation, so that people with disabilities have the support to, you know, exercise their decision making and choice in their lives. And in particular with Ireland about to report on their implementation of the United Nations Convention on the Rights of Persons with Disabilities, this act will be a key part of that. So this act needs to be fully commenced, and to do that, the DSS, the Decision Support Service, needs to be funded for that. And again, that comes through in our consultation quotes from people. They say, someone has said, people with disability need support to make their own decisions, to be able to stand up and voice their opinion, to be heard. Sarah Jane, I don't know if you want to come in on that as well. Like, how do you feel the importance of the Assisted Decision Making Act?
Well, I think they need to tell people where their offices are, and that people, if they need help, they can go and get it.
Yeah. So yeah, I think one of the key things
and they need to get it going properly.
Yeah, an information service, and I know their website is now live, so the website is up. But I think you're right. I think people need to know more about the decision support service and how they can get support. So you're absolutely right, and that's probably a key to getting funding to fully setting that up.
Yeah.
So that brings us then to this slide now, which is a summary of all of our asks. So you'll have seen that we kind of focus on our priority asks within each section in this presentation, and as Enda said at the beginning. So if you look at this slide, you'll see the 4 sections, the 4 teams: education, rights-based services, supporting social inclusion, and equality and participation. So there is multiple asks under each of those, and you can look at this on our website as well, which Enda's going to go through now in a second. So I'm going to pass you on to Enda now at this point.
Okay. Okay. So what we have devised here is a sorry, just some technical issues. What we have devised at this point is a tool for people to make contact with your local TD. To do this, you can go on to Inclusion Ireland's website, and that's what we're looking at here at the moment. And this is going to allow our members and our supporters to write directly to your local TD or to any of the ministers that you wish to write to, with a letter that we have drafted and designed, which is aimed at our pre-budget submission 2021, highlighting what the key priorities are. However, if you also wish to write your own personalised letter, this process will allow you to do so. So you go into our website, and this is the first page you'll be looking at. I'm just going to take you through the process at the moment. And you go to budget 21, which is this icon here on the top right. You click on that, and that will bring you into this page, which is all about budget 21. And we have a number of different items and tools here which will help you to lobby for the key priority that we're asking for. So you'll see our pre-budget submission. You will see our easy read version of our pre-budget submission. You also have all the summary asks that we're looking for. And then we also have an Inclusion Ireland infograph, which you can use for lobbying TDs directly, which goes through basically the slides that Rob has just gone through in the last few minutes, which is looking at the summarized key priorities that have come through from the consultations with people with disabilities and their families right around the country. When you scroll down the page, it will take you through to the actual lobbying tool, which will allow you to get directly involved with your TD. You will see here that it goes through 4 key priority themes that we have just talked about. And on the right-hand side here, you'll see a map of Ireland, and you have each one of the constituencies. So you can go to the top of that map, and there's a little scroll down bar which you can press on, and it brings up all the constituencies in the country. So you can pick out the constituency of your choice. And you can write to your TD, and I'll show you how to do that. But you could also, for example, go into a TD who is now a minister, for example, Anne Rabbitte, who will be in Galway East, or you would have Roderick O'Gorman, who would be Dublin West, and obviously other ministers as well. And you could pick them out within there, and you could write to them directly. For the moment, for the purposes of our demonstration here, I'll just go into the very first constituency, Kilkenny. And if you click on that, it will bring up for you the list of the TDs in that constituency, and you can decide by clicking on them which ones that you want to select or deselect. So for example, you can deselect any one of the TDs by clicking on them and re-click to bring them back again. What you do is you put in your own name, your email address, the area, town that you live in. So you just fill in your details there. And that will then bring you on to the next section. And this is where the letter is. Sorry, just bear with me for a moment as I move things around on the screen here. So this is the actual letter we have scripted for you to send to each TD. And I just take you to the letter. So it says, I'm writing to you to request that you promote the rights of people with intellectual disabilities and their families in the forthcoming budget 2021. It's important that people with disabilities are not left behind, and the government takes steps towards implementing the United Nations Convention on the Rights of a Person with Disability through the budgetary process in 2021. And then we give the examples of the priorities that would facilitate people to live self-determined lives and create a more equal and just society for people with disabilities. And you're saying here, I'm asking you to raise these issues with the relevant minister in Dáil Éireann so that they are addressed in the forthcoming budget. And then we list out what the priorities are that Rob has just gone through: investing in inclusive education, providing rights-based services, supporting community inclusion, and obviously underneath that one you have housing, you have employment and poverty, you have transport. So that covers quite a lot of issues that people reported back to us as being important to you. And the final one then, enabling equality and participation. It also goes on to say that Inclusion Ireland will be hosting a pre-budget submission forum for TDs and senators on the 23rd of September. And that's a process where we will invite TDs and senators along to a Zoom conference facility very similar to this, where we will give them a presentation of what the key priorities are, and we'll then be asking them to go back to the ministers and to put pressure on the ministers. So in your letter here, you're asking them to attend that function on your behalf, to come along to it and to listen carefully to what your voice is and what your lived experiences has been and how you want that reflected in the budget. And if you wish, you can, of course, delete any of the text by highlighting it here. And by doing so, you can write your own letter if you have specific issues that you want to raise. At that point, then you can just preview your message if you wish. And it'll give you the opportunity to make any changes if there are any errors along the way. If you can bear with me now as we move back towards the main presentation, and
I will share my screen now, Enda.
Thank you.
Okay. And that's the infographic.
What I would also suggest to people would be that what we want to do in Inclusion Ireland, based on our current strategic plan, is we want to ensure that the lived experience and that the voice of people with intellectual disabilities and their families are heard at a local level. And this is what's quite important to us, and this is where we're going to be moving to across the next couple of years in terms of how the organisation operates. You know, we have 39 constituencies around the country. We have 160 odd TDs, and we have about 60 senators. It is important that each one of those people are familiar with whatever the issues are affecting people with intellectual disabilities and their family. The only way that can really happen is through yourselves and through our membership and through our supporters. As part of the pre-budget submission, we put together this infographic, which is basically the key priorities that we have spoke about in this morning's presentation. And it just breaks those down very simply. This is a document which is available in hard copy. Contact the office, you can get a copy of this, or you can simply just print it off. It is available on our website there on the section in relation to pre-budget 2021. Very, very quickly, a set of bullet points really highlighting what the issues are, but it's a very handy have if you're actually going to talk to TDs in their own constituency or over the phone along the way. I would encourage people also, along with sending the letter, to actually pick up the phone and contact TDs and just talk to them about what our key issues are, because it's important that, you know, in a time like this, this particular budget is going to be very difficult. There are a lot of challenges for the government in relation to budget 2021. And unfortunately, in politics, it's very much a case of he who shouts loudest for the longest gets listened to, and we need to be very active right around the country in each one of our constituencies in relation to what your key priorities are. So just to, I suppose, finish off our presentation this morning, I want to thank everybody for tuning in and thank everybody for listening. I want to thank Rob and Sarah Jane. For further information, you can go to our website at www.inclusionireland.ie. You can contact our office on the number 01 855 9891 or email us at Inclusion Ireland. Please do use the contact TD tool. I think this is very important. It's on our own website. It's our own tool at this point. We have it. We'll be using it all the time for all our campaigns. And as I say, you can use it to script your own specific letter if there are specific issues, or you can send the letter that's there. Regardless, I think it is very important to request your TD to attend those particular presentations that we're going to give to the TDs and the senators on the 23rd of September. That's a very important date, and I would ask people just to pick up the phone also and ring their TD and say, look, are you going to attend that function? I would also ask people to join the organisation. We need more people as members, and we need people right around the country. And the messages that we give from Cahersiveen to Belmullet need to reflect the voice and the experience of our members and of people with intellectual disabilities and their family. And as I say, within our new strategic plan, that's going to be a key issue for the organisation as to how we develop structures to allow us to do that over the next couple of years. But certainly the Contactor TD tool is something that we would encourage people to use, and we will be using it across all our campaigns in the future. So at this point, I think that is our conclusion. I want to thank everybody for tuning in, and stay safe. Thank you.